everyone, welcome back to the show. You are watching now our signature segment, See the Stories. As we mentioned earlier, we want to talk about tonsils today. So I don't know about my friend here, Yani, but I never had any experience with tonsils or tonsillitis, not even my kids, not even my husband or other family members. So I really don't know anything about it actually. What about you?
No, I don't think I've ever had anyone in my family who had experienced this, but all I know ever since we were little, if there's something wrong with your tonsils and they have to take it out, that means you get to eat a lot of ice cream. That's
Oh,
all
you
I
do?
know.
Okay. I don't know whether it's an old mother's tale or what, maybe it's a fact, right?
Yes, so I can't wait to find out more. So today, we will talk about understanding the functions of tonsils, its disease and treatment with a medical doctor at the ED Junior Doctors Network, Dr. Ivana Supit. Good
Hi,
evening.
Doc.
Good evening.
Thank you so much for being here.
Thank
you
So
for having me.
obviously you've heard that we pretty much want to know more about tonsils.
Yeah.
So what are tonsils and what is their function on the body?
Okay. So basically, tonsils are lymph nodes that located around the pharynx area. There are four tonsils,
Okay.
which are a pair of palatine tonsil that can be seen when we open our mouth, and then the lingual tonsil located at the base of the tongue, and then a pair of tubal tonsil located at the opening of eustachian tube, and the last is the adenoid tonsil that is located behind our nasal cavity. So this tonsil will form a chain of lymphoid system called the Waldeyer ring. And those tonsils form as a protective barrier towards germ before entering the airway or digestive tract.
Okay, well, can you explain more about that? As you mentioned that it's actually a protective, it builds a protective system for our body system, right? Or immune system. So what are the roles of these tonsils?
So each tonsil, so basically tonsil is categorized as mucosal associated lymphoid tissue, which means in each surface of each tonsil, they have a specific lymphoid cell that will trap and capture the germs before entering our aerodigestive tract. And then after they trap the germ, the tonsil will stimulate other host immune system to help them to fight against the germ.
Okay, see, we learned something new. Just from first question, I learned that we have four tonsils because I thought we only had two, right?
Four
Okay.
types.
Now we want to know what are the symptoms of tonsillitis and how is it typically treated?
Yeah. So basically, tonsillitis is the inflammation of the tonsil. Tonsillitis can be acute or chronic.
Okay.
In acute tonsillitis, sometimes people feel sore throat, sometimes accompanied with fever, malaise, and sometimes in younger children, they will dehydrate because lack of intake, because they feel sore throat, uneasy to swallow. Nah, on chronic tonsillitis, sometimes we don't really realize that we have chronic tonsillitis until they become quite large. Like when palatine and adenoid tonsil become large and block the airway, sometimes they will cause sleep apnea. Or when the adenoid tonsil is large and block the eustachian tube, then it will cause infection on the middle ear. So that's why when chronic tonsillitis occur, it is the complication of tonsil, the complication due to the enlargement of the tonsil that will make we feel something.
So, I mean, how do you differ that from the normal inflammation of throat inflammation, for example? And this happens a lot in kids, right? Sometimes they
Yes.
cannot differ whether it's the tonsillitis or is it just throat inflammation. How do you tell the difference?
Okay, so basically from history taking, we can see whether the kids complain of sore throat or any fever, malaise. Nah, and then when you see the doctor will check your oral cavity. Then we will see that there is hyperemic, and then edema or inflammation around your pharynx and also the tonsils.
Okay. So,
So how can it how is it typically treated? Is that a medicine that we can just take, or do we actually have to go to the doctor, or we have to be hospitalized maybe?
Yeah.
What is it?
In acute tonsillitis, we can treat with symptomatic medical. For example, if you have fever, then you can have antipyretic or analgesic for the sore throat, and then some vitamin to boost your immune system. But in chronic tonsillitis, of course, it is different. The treatment for the chronic tonsillitis depends on some criteria and depends on its condition.
okay, in some circumstances, some tonsil stones might form. Are there any, can it form in anyone, or are there any specific risk factors that create these stones?
So the tonsil stones are more likely happen on adults. Child more less happen with tonsil stones. When our tonsil enlarge, they will form some pits. So these pits, when we swallow food or there is bacteria, sometimes people with bad hygiene, causing this debris to trap inside that pits and crystallize to form the tonsil stones.
When you talk about hygiene, how do you maintain the hygiene of your oral area so that it prevents the formation of stones?
Yeah, so if you have an enlarged tonsil that have crypts, or the crypts is the same as pits, it is better for us to keep garbling. You can garbling, keep your oral hygiene good. Those are things you can do to prevent the tonsil stones.
Okay, so it's true that tonsil stones can cause bad breath?
Yes.
I mean, is it true as well? I don't know if it's correct. I mean, we talked to Ahir, and he had these experiences with tonsils, and he said he was not allowed, or maybe to limit the intake of cold water or ice cream sometimes, and even something that is having a lot of MSGs, like certain foods with MSGs.
Yes. So basically, MSGs or ice sometimes may trigger the inflammation, like hypersensitive of the tonsil. So it will make you feel uncomfortable.
Wait, so now I want to ask, because earlier I said when you get your tonsils removed, you can eat a lot of ice cream. So is it true? Is it myth? What is it?
After removing the tonsils, usually we will feel the pain. That pain can be reduced by taking the ice cream or cold water.
So it's like compressing with something cold. But if the tonsils are being removed, so what about the protective system that was mentioned by you before as the role of those tonsils?
Some people afraid that if we remove the tonsil, then they will decrease their immunity. But there are a lot of studies that found there is no significant difference before removing tonsil and after removing the tonsil, because our body will adapt.
Okay. So then would you say there are any, long-term consequences of removing tonsils? I mean, especially for young kids.
There is actually no, because no long-term consequences, because of course our body will adapt.
Okay. So are there any other remedies? You mentioned about acute and chronic to some people that have, regularly having problems with tonsils. Is it better to have it removed or is it better to keep it there? And also, sometimes they also have problem with sleep apnea. You mentioned about that, and that might cause death to some cases. So, what is your take on that?
So if these tonsils have become problem, it is best to taken out the tonsils
For the removal.
For remove the tonsil, because as long as the tonsil were there, then it will keep block the airway.
Right.
Yeah.
So it might block the airways, it might cause the sleep apnea, as you mentioned.
Yes.
And so, how to treat it if not being removed?
For some people that is not not able to do the surgery, sometimes there are medication to help them, or we try to give some kind of antibiotics and anti-inflammation drugs to help them reduce the complication of the tonsillitis.
Okay.
However, if it is not work, then surgery is still the option.
Okay. All right, we still need to dig more. So for the next See the Stories segment, we'll still continue to talk. That's going to be after the break. Don't go anywhere.